Welcome, Dr. Dickerson. I'm curious if you can just start by telling me how your choice to become a nurse has impacted your life.
I think nursing has been listed as the most trusted profession for decades now, and so I take a lot of pride in that. I think the wonderful thing about being a nurse is all the different things you can do as a nurse. My career, if you looked at my resume, it's interesting. I've been, an educator. I've been a clinical nurse specialist. I've been in leadership. I've been in a marketing position.
I'm not sure if everyone is aware of just how much variety there is within the nursing profession and how many of us have similar stories that, we've done dozens of different roles. So as the chief nursing officer at VHC, what do you see as the most important nursing workforce trends right now?
Baby boomer generation started to retire. We knew there was going to be kind of a gap there. And so what's interesting right now, this is one of the first time, that's actually the first time in history that you have 5 generations in the workforce. But, I think what's important is that the opportunities, there's more than ever for that new grad. And when I came out of nursing school, you would never hire a new grad into the ICU. And now we do.
So I wonder if you could talk to me about why you like to hire Marymount nurses and what qualities stand out in our graduates.
Well, I think Marymount, number one, I think you do a great job at being selective about your student body. Marymount nurses are typically very professional and poised, and the clinical leaders that are the instructors and faculty of Marymount are just second to none. You really do a tremendous job. We are proud to be the community hospital for Marymount. We see a lot of Marymount students. And so we've worked with Marymount to create a lot of great clinical experiences in, again, your traditional med surg, but also all over the hospital, in peri-op and the ICU and other places that just make sure that that the Marymount students get a great understanding of who we are. I think to be at VHC Health really sells VHC Health. We have a culture and an environment that is very welcoming and different than what you'll find in other institutions.
You and I have worked closely together, kind of enrich our partnership, and I think that program really underscores why we're really on the same team in terms of preparing nurses for the workforce. Well, Dr. Dickerson, thank you so much. I appreciate you taking the time to talk to us today.
All right. Thank you. It was a pleasure.